Your voice, your community station. You are listening to IPL Radio.
Bachelors there with I Wouldn't Trade You for the World. And in the studio right now, we have a very special guest. We've got Michelle from South Coastal Health Services.
Hello.
Welcome to IPL, Michelle.
Hi, thank you for having me.
No worries at all. And tell us a little bit about the health services and your role in South Coastal.
So I'm the manager of the mental health services and I'm a registered psychologist.
Right.
We are in the centre of Rockingham on 4 Civic Boulevard and we provide services for all of the family. We have mostly counselling services predominantly. So we can see women experiencing family and domestic violence, women who are experiencing postnatal depression and other perinatal concerns for counselling. We also see children who've experienced family and domestic violence, and everybody else that doesn't quite fit in that category can either go into our emotional health and wellbeing program for women and young women 12 and up, or other members of the community such as men are often captured best by our Better Access services where they get to see a psychologist.
Right. Sounds pretty daunting because you must be seeing a lot of people in a lot of desperate situations.
Yeah, that's right. Our clients are, often experiencing probably one of the worst times of their lives, and it's really fortunate they're able to reach out for support, and we're very happy to be there and help them through this part of their life onto the rest of their journey. So we, all of us on the team feel quite blessed to be involved in people's lives and supporting them along their way.
Right. And when you have a client come in, it's not just a sort of a one-off sort of counselling session. It's a progressive thing, is it?
That's right. Under most of the programs we offer, clients can access up to 10 sessions of counselling per episode. So they can come for individual counselling, which is limited to 10, or they can attend some of our group programs as well, which, depending on the group, runs for about 8 to 10 weeks.
Right. And this week, of course, is Mental Health Week. And are you doing anything special to promote South Coastal Health Services this week?
Yeah, we definitely are. We have a lot going on this week. It's also South Coastal's 30th birthday, so we've got a big birthday celebration tomorrow. Aside from that, for Mental Health Week, we've been in the Rockingham Centre promoting our services with other services, with a little table display and an opportunity for people to come up and interact with some of us. And we also have little self-care packs that we're giving out to clients,
right.
Which has been provided by funding that we got from WA Mental Health Association. We also got funding from Bunnings to donate a few items, teaching tools, and we also got some donations from, I'm forgetting someone, I'm feeling really bad.
Well, it'll come to you later.
I know.
Now, do you find that people feel that there's a stigma attached to mental health and put off coming in to see you guys?
Yeah, that can be quite a barrier for people accessing supports at the right time as well. So I think definitely the first starting point is to chat to your GP and get a gauge on how you're feeling, and if that's within what we consider the realms of normal, air quotes on normal there. And then the GP can usually direct you to the right service, whether that's exploring some health concerns, whether that's exploring counselling services like what we have at South Coastal.
Right. So most of your clients referred to you, or do they come off the street, so to speak?
Yeah, we will accept clients who what we call self-refer for our family and domestic violence counselling. We do prefer that they're referred for counselling through their GP, just so they've got another person to link in with for support. Right.
And do you find that by the time you get to see them that their situation has deteriorated to a large degree that makes it more difficult to assist them? Would you, for instance, would you be able to better assist them if you caught them earlier?
Absolutely. I think prevention is a significant factor in reducing the burden of mental illness on the population. Unfortunately, like many services in the area, we are only so many people, and there are so many people in the community that need support. So where we see someone needing support right away, we will try to prioritise them, but we do unfortunately have quite a long wait list. So while they wait for services, it can deteriorate at times, and that's why having their GP involved is so important. So they've got someone else to link in with who can maybe, bump them up the line or get them linked in with community mental health services.
Now, you mentioned preventative measures. What sort of preventative measures are available to stop people getting to the desperate need situation?
I think the biggest part is just recognising within yourself that things aren't tracking as well as what they would have. Sometimes people leave it too late before they do recognise it and reach out for support. Some really early indicators for everyone's different, but changes in your mood, being a little bit more grumpy, not sleeping so well, finding that you're a little bit more stressed out or anxious. These are little signs that things aren't tracking so well for someone. Sometimes people just need a little nudge to get back on track. It can be going for a walk along the beach more regularly, doing something that they enjoy, dedicating that time to themselves. That's why the focus for Mental Health Week at South Coastal has been about self-care. And it's not complicated sometimes to do those little things that will lift your mood. It's sometimes just kicking yourself up the butt to go and do it.
But just speaking a little bit from experience, is mental health, it's all in the mind, and when you're alone and you don't have someone to talk to, these things can build up without any effort at all in your mind.
Yeah.
And I remember reading a story in the Bulletin magazine many years ago about two guys who had been best friends all their life, and one of them committed suicide, and the other guy did not know, that's his best friend, did not know that he was going through those situations. Now, I think men find it difficult to communicate these sort of things than women. Is that your experience?
Absolutely. I think it's a really unfair kind of stigma around men and their mental health the most.
Yep.
So I'm really glad there's more initiatives out there to improve men's mental health. And I think even Are You OK Day is taking quite a clear direction towards men asking that question and having conversations amongst themselves. But you're right, it's so hard for friends and family to know sometimes how to support someone. They might not even recognise that things are different. So it is, as hard as it is for that individual as well, it's very much up to the individual to recognise, hey, this isn't right for me right now and I need to go talk to someone.
Yeah, because we all tend to wear a mask, don't we?
Yeah,
and we try and sort of not allow people to see the real me.
That's right, yeah.
Very good. You were talking earlier about people getting early intervention, but when you're in a position of very poor mental health, it's very hard to sort of make that step.
Yeah.
And that's where you say the GP needs to come into it.
Yeah. I mean, regardless whether it's health or physical health and mental health, you really do need to be able to reach out to someone to get help. If you've got a sore on your arm that's not healing and it's getting worse and worse and infected, no one can really help you with that until you do go to the GP. Obviously, that's a little bit more visible than mental illness, though. So someone might nudge you to get to the doctor.
Yeah.
But, if you are noticing someone in your life that doesn't seem like they're on the normal, in the normal moods, or they're having some disruptions to their sleep and their usual activities, and that's a good time to ask that question, are you okay, and can I help you, and encourage them on that journey to getting support.
Yep. Now, in the Rockingham area, we do have a lot of homelessness. That must contribute a great deal to the mental health situation in this area.
Yeah, absolutely. It's such a tricky one as well. It's kind of chicken and egg. And a lot of people who are experiencing homelessness do report their mental health is getting in the way of them accessing secure housing. But of course, if you don't have secure housing, you can't also work on your mental health. Correct. So it's an age-old question of where do we start first? And, it's something that at a more higher government level, things need to be explored a little bit deeper to provide support.
Do you think over the, probably the last 5 to 10 years, that attitudes towards mental health have improved? Because I know when I was much younger, if someone had a mental health problem, you thought they were ready for the loony bin. But I think that whole attitude seems to have turned a corner.
Yeah.
Would that be true?
Yeah. I don't know whether things have become more common. So 1 in 3 women will experience a mental illness at some point in their life. For men, the statistics are more like 1 in 5, but who knows if that's accurate due to low self-reporting. I don't know whether it's just becoming more common, so more people are talking about it, but it's a great direction to be headed. There's a lot of stuff out there on social media that's really in support of mental illness as well and accessing appropriate support. So I'm really pleased that it is becoming less of a stigma around accessing help.
With social media, is that a contributor, do you think? Especially with teenagers and the sorts of things they convey on their social media?
I think teenagers are always going to be teenagers.
Right.
Their hormones are going to make things a little bit difficult at times and work against them at times. Social media can be a great outlet for them. And I know there's over the years been lots of buzz about different TV shows that portray mental illness in certain ways. So, it's one of those things that we've just comes down to the individual and how they're coping with it and how much social media is too much for that person, how much it's a help, how much of it is a hindrance. So it's such an individual kind of influence.
Mm. Yeah, there was a program on the ABC over the last 6 weeks on teenagers in, it was old people's homes for teenagers.
Okay.
And it was very interesting that on both sides of the fence you had people who were lonely, put them together, and they were strangely able to communicate with each other, which was amazing.
Well, that sounds good.
Yeah.
I mean, sometimes we need to shake things up and do different things, and that sounds like an interesting solution to an age-old problem.
So what are you doing this week to promote mental health?
So for everyone that pops in for Civic Boulevard, we have little gift packs for them to collect. We have different themes to those gift packs, all focused around self-care. So we've got a wonderful donation from Bunnings, so they can get a little pot, a little shovel and a little plant and one of those classic Bunnings hats.
Yep.
We have a self-care pack to encourage better sleep. We have a pack to improve relaxation. We've got a little teacup with some relaxing tea and bliss balls made by our dietitian. We've got one for being creative with a little journal and pen in there. So lots of different options for them if they wanted to pop in, and that's all been wonderfully donated. So we're really grateful for that.
Excellent. And apart from mental health services, what else does South Coastal Health provide in the way of health services?
So attached to us is also Babinga Maya, which is the Aboriginal Health Service. They have kind of across the whole lifespan. So from pregnancy and seeing the midwife through to the child health nurses, through to the mental health workers, we can kind of support people over the lifespan through Babinga Maya as well. So that's a really wonderful service that we have also.
Excellent. Anything you'd like to add?
No, I just... thank you for having me here, and I'm glad we can talk about mental health because this is a really important part of reducing that stigma and having conversations like this. So
that's right.
Thank you.
Going back to when I was a teenager, no one talked about mental health. It was just a subject you didn't broach. So that is healthy. And Are You OK is a very simple way of helping people, and it's and people. I think people feel comfortable saying, "Are you okay?"
Yeah.
And excellent. Well, it's great to have you with us, and thank you for taking the time to come in to IPL Radio and to share with us.
Thank you. My pleasure.
Your voice, your community station. You are listening to IPL Radio.